Hey everyone, in this video we will be going through an overview of the various heart rhythms and a few other things that you need to know in order to be successful in reading EKGs.
Welcome to CAS-RN, where I teach you about all things nursing.
We are going to go through the definition of dysrhythmias, symptoms that your patient might experience. We'll review an EKG. We'll go through the various dysrhythmia categories, and I'll give you the introduction to a 5-step method that you can use to solve a dysrhythmia just from an EKG. So to begin, let's look at the medical terminology when it comes to dysrhythmia. So dys means bad or difficult, and rhythm means rhythm, right? So the medical terminology describes the condition pretty much perfectly. It means a bad or difficult rhythm or a disruption to that normal heart rate and rhythm, which has multiple causes, but is ultimately just that disruption of the electrical impulses or the pathways within the heart. And some of those dysrhythmias can cause death, while others don't cause any problems other than seeing them on an EKG strip. So when the heart isn't beating properly, as it's supposed to, it decreases the cardiac output, or the volume of blood that's put out by the heart. So this is going to decrease the amount of oxygen-rich blood that is delivered to the rest of the body and to the heart itself. So going through these symptoms, you can see why a patient would experience them when they're having a dysrhythmia. So they might experience anxiety, diaphoresis, which is the medical term for sweating, dizziness, fatigue, hypotension, and low blood pressure, some lightheadedness, palpitations, which they can kind of feel their heart beating funny, some shortness of breath, some syncope, which is passing out, or some weakness. When the body doesn't have the oxygen that it needs, these are some of the symptoms that you're going to see. So these symptoms could accompany other experiences, but specifically we're going to see them inside dysrhythmias. Now, a quick review right here is this is just a heartbeat on an EKG rhythm, and it's really important for you to understand the P wave, the QRS complex, the ST segment, and the T wave, and then we've got our PR interval and our QT interval. As we go through this, what you need to know the most is just written right here off to the left. We have our P wave, which is atrial depolarization. So that is when the atria are getting that impulse to depolarize, and it's going to cause the atria of the heart to contract. Then we have the QRS complex, which is ventricular depolarization. This is when the ventricles of the heart are contracting because they're receiving that electrical impulse. And then the T wave is actually when the ventricles are repolarizing or relaxing. And that's important because we need the ventricles to refill properly with blood so that they can then contract again and get that full force and that full volume of blood out to the body. Okay, so the electrical impulse of the heart starts in the SA node, which is right here, and then it passes down through the AV node, which is the atrioventricular node, and then it's going to go down here, and then we've got it into the bundle of His, to the left and right bundle branches, and then down into the Purkinje fibers, which are going to go up through the walls of the ventricles. So something that's important to make sure that you know in the fail-safes is that the body has built into it, when one of these systems fails, it's got a way to keep everything going just in case. So first off, that SA node, if the SA node is going to be your basic pacemaker of the heart, right? It's just going to give you your baseline beats per minute, which is going to be 60 to 100 beats per minute at a resting rate, usually a little lower than 100, but sometimes that's normal for people. Those that are actually athletically fit, however, this is just kind of an interesting thing to know, have lower heart rates. So for example, Usain Bolt, he has a resting heart rate of 33. So that's really abnormal for the rest of us, but for some of those high-level athletes, you're going to see lower heart rates. Okay, so then what happens is that if the SA node fails for some reason, then we've got our atrial ventricular node, and it's actually going to pick everything up, and it's going to beat 40 to 60 beats per minute. And it's because it's still trying to get blood going, and it's going to keep everything pumping so that the rest of the body can get the oxygen-rich blood that it needs. Now, if both of those happen to fail, then we've got the ventricular pacer cells, which are inside the ventricles, and those are going to beat at 40 beats per minute or a little bit less. So see, we're slowing down here. And then we come down to the Purkinje fibers, and they're just going to do their best, but there's not a lot that they can do there, and they're going to beat at 20 beats per minute or less. So the body has this awesome built-in fail-safe to protect it just in case one of these systems fails. All right, so now let's go through the type of dysrhythmias. We can pretty much divide these into categories. You've got the atrial and the ventricular, so it's those parts of the heart that are failing. And then we've got a couple other issues. So atrial dysrhythmias are caused by a cell inside the atria other than the SA node firing when it's not supposed to. So there's a different cell inside the atria that's shooting stuff off when it's not supposed to do that. So there's 3 types specifically, and it's the premature atrial contractions, which are called PACs, atrial fibrillation, which we call AFib, and atrial flutter, which you can call AFL. So I did, however, choose to include supraventricular tachycardia and junctional rhythms in this category because supraventricular tachycardia, or SVT, originate above the ventricles, so it could still be something in the atria or the AV node that's causing it. And then we've got the junctional rhythm, which begins in the AV node. So those two on the bottom inside atria could be part of the AV node. So just make sure that you understand that. It's not necessarily an atrial dysrhythmia. Then we've got our ventricle dysrhythmias that are caused by a cell inside the ventricles that are firing when they're not supposed to. So for these dysrhythmias, there's going to be no P wave. So what that means is that the electrical impulse is initiating inside the ventricles as well. So it's actually going to take out that P wave. So reflect back just a couple slides ago, we were talking about the P wave, how that's the contraction of the atria. Well, in this case, the ventricles are kind of taken over and they're skipping the atria. And so there's not going to be a P wave on the EKG. So you're going to want to remember that. So then these ones are going to be the premature ventricular contraction, the ventricular tachycardia, ventricular fibrillation, and idioventricular rhythm. Then we've got our cardiac rhythms, which are sinus bradycardia and sinus tachycardia. These are actually the exact same as a normal sinus rhythm, and we'll go over that in a future video. But we've got, these ones are going to be the exact same, only that bradycardia is going to be slow and tachycardia is going to be fast. We have asystole, which is a complete lack of heart rate, also known as flatlining, and then the heart blocks. The heart blocks are just like they sound. It's just when the electrical impulse is blocked or delayed. And there are 4 different types of those. There's the first degree. We have the second degree type 1, second degree type 2, and then the third degree AV block, which is also known as a complete block. And we will go through each of these different dysrhythmias in future videos. Then next up, this is just a brief introduction into this. In my normal sinus rhythm video, make sure to go through and watch it because we'll go through this in depth. But in order to look at an EKG strip, these are the 5 things that you need to be looking for. You need to determine the rate and rhythm. Those are the first 2 most important things that we need to look at because that's going to give us our basis of whether or not this is even a dysrhythmia. So we're going to check out rate and rhythm first, and then we're going to evaluate that QRS complex, make sure that there is one. And then we're also going to look at the interval on the PR interval. And then we want to make sure that there is always a P, QRS, and a T ratio. So it should be a 1-to-1-to-1 ratio. There should be a P, and then a QRS, and then a T. All right, quick review. So a dysrhythmia is a bad heart rhythm, something that's abnormal. It's going to cause a decrease in cardiac output, and so our patients are going to have related symptoms to that. Make sure that you understand an EKG rhythm and how to review that, and if not, jump back to my EKG basics video. We have lots of different categories that dysrhythmias are going to be, but it's going to be either an atrial or a ventricular dysrhythmia. Then we've also got a couple other heart blocks, asystole, which is no rhythm at all, and our bradycardia and tachycardia. And then the 5-step method are 5 things that you need to be looking for every time you look at an EKG so that you can understand if it's a regular heart rhythm or if the patient is experiencing some sort of dysrhythmia.
Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.